Hairline repair surgery. I am Doctor Arvind Poswal from Dr. A's Clinic, Delhi, India, and today we will be talking about a topic that concerns many people. See, hair transplant is an art. It is not just a surgery described in a book or on YouTube. Unfortunately, the requirements for being a hair transplant surgeon is that just you are a doctor. No training required. So many a times doctors enter into this field with minimal training, either from checking YouTube or just attending 2 or 3 day workshops. Now, for learning the art of a surgery, one really needs something like 3 to 6 months at least. And hairline is something very precious. Anyone going for a hair transplant, he has to understand that, and even his doctor, that this hairline is something of a dream for him. This is something which you will be seeing for the rest of your life. So it should be, there are 3 things which I will be talking about in this, right? One is, what are the aspects in hairline? One is, where should the hairline be placed? So one is, we are doing it in this manner, parallel to the eyebrow. When we keep the hairline parallel to the eyebrow, that is a non-balding hairline. But in this respect, understand that this area should not be covered with hair. This is the temple which an adult male should have. I sometimes find people who have a hairline starting right here and going all the way like this. This is not a man's hairline. In nature, hair does not grow in this area, except when one is a child, or if one is a lady, or of course in exceptions like Shah Rukh Khan. So if you are losing hair and you are going for a procedure, so first of all, get the hairline marked clearly. And even during the consultation, you should take the initiative. As a patient, you have to take the initiative and mark out the hairline for yourself and tell the doctor that this is what you have in mind. That way the doctor will either refuse that surgery, maybe if you are going for a line entirely like this, even I will refuse you a surgery, because that is not realistic, that is not natural. The second thing is that the density should always be there. Sometimes you find people with hair very far apart in the hairline. That will never look alright. Low density is not something you can pass off in the hairline area, in the frontal area especially. So at least till 2 to 3 fingers it should have good density. How much is good density? For Indian patients, it is around 40 to 45 grafts per square centimeter at least. So a good density is required, proper graft placement is required, correct angles and directions are required. The hair should not be pointing upwards to the sky. They should be pointing as they are pointing in nature. You find there may be a cowlick hair. This hair may be pointing straight forward. Another area you may have slightly different one. So it is the job of the hair transplant doctor as an artist, not as a doctor, as an artist, to mimic what nature gave you. If you mimic what nature gave you, then it will always look natural. So, like I said, I will talk about 3 things. One is placement of the hairline, the other is directions and angles of the hair, and the third is density. All of these, if you can manage to get all of these 3 done correctly, then you will fall in love with that hairline. That is something you will be proud of. So if you have any questions, do not hesitate to contact me. And if you have got a wrong hairline also, like this particular case, then also do not worry. We can take out grafts even from this area. Some patients I see, they have grafts growing all over their forehead, where there is no reason why there should be any hair. So in that cases, patients do go for something which we call hair transplant reversal, removing that hairline. That also we do if the grafts are too low here, then we will be removing them by FUE. We can place them back into this area where you have hair thinning, or we can place it back into the donor area also. But it is my deepest concern that people should not be getting turned off from hair transplant surgery because their doctors do not have a sense of art. So always remember, when you are going for a transplant, you need to see hundreds of cases of that particular clinic or that doctor. You have to see. You are not looking just at degrees. You may be a super specialist. That does not matter. What you will be looking for, does that doctor have a sense of art? Is he an artist enough to give me the hairline which looks so dense, natural and young as I want? That you will find only in results, and even then in large scale pictures, not small pictures, so that you can make out what the artistic ability is. And do remember, like this post, share it and do subscribe. It really helps us. Thank you.